It's early in the evening on the Monday after Thanksgiving, and the emergency department at UC Health's Westchester Hospital has been full since sunset. Outside of the hospital, rain pours down, causing heavy traffic in the local area. Dr. Sanjay has already seen 8 patients since his shift started at 3 p.m. He is joined by 2 other physicians in the emergency department, along with a skilled team of residents and advanced practice providers who are ready to act at a moment's notice. 5:51 p.m. Cassie Jeffers, RN, receives a phone call from a local EMS agency.
We've got a multi-car vehicle accident happening, 30-year-old female that was a restrained driver that was involved in a rollover accident. They ended up having to cut the roof off the car to extricate her. She's complaining of chest pain, belly pain.
Their blood pressure's low, their heart rate's high, and so in that situation we call on all the hands we can get, specifically our trauma team, so we can assemble and be ready for the patient in the trauma bay so we can give them what they need as fast as possible.
5:55 p.m. The trauma team includes an emergency department physician, 1 trauma surgeon, and multiple nurses and medics. 5:58 p.m. Dr. Sanjay and Dr. Millar huddle with the rest of the trauma team to develop a plan to treat the patient when she arrives.
It's a young woman. There was a casualty on scene, multiple vehicles, and it was a rollover. She's tachycardic and hypotensive, but awake and alert.
6:05 p.m. EMS transports the patient to the emergency department. With a plan in place, the trauma team rushes her into one of the trauma bays. Although she is alert, she is clearly in a lot of pain. 6:10 p.m. The team examines the patient. She has a strong, palpable pulse. Her pelvis is stable, but she experiences excruciating pain in her belly and sternum. Dr. Millar orders x-rays of the chest and pelvis. Her lower extremities are intact, but an ultrasound reveals that she is bleeding internally. She also suffers from hypotension or very low blood pressure. 6:32 p.m. After she receives pain medicine, the trauma team wheels her into the operating room for an emergency procedure to evaluate the source of bleeding. She needs this surgery, but makes a full recovery after spending a few days in the hospital. The trauma team successfully treats the patient in a quick time to save her life in only a matter of minutes.
So we come together as a team, and we each play a role in that process to really support that one critically injured patient. Trauma is a team sport. None of it can be done independently.
First and foremost, if a decision's to be made that's being debated, it always comes down to the patients first, and then everything else that falls afterwards. If we ever have a trouble with a patient or a systems problem, I can talk to Dr. Millar, and in a heartbeat we'll decide what's best for the patients in general. The administration stands behind that. Everyone stands behind that. It's just the culture that's provided here to provide the absolute best thing for the patient. And so it's a pleasure and honor to work here, and it's a place like I've never worked before.